Welcome to High Tea with Grace, where we spill the tea on HIT. I'm thrilled to be here at the ViVE Conference, interviewing the industry's greatest leaders about pressing issues in the industry. So tell me, who are you and what do you do?
Hi, Grace. My name's Virginia Halsey, and I am responsible for product strategy and product management at First Data Bank. First Data Bank is the drug content that's built throughout healthcare systems, throughout the whole continuum. So throughout the hospital, ambulatory care, PBMs, web apps, CVS, all over the place.
Amazing. So
Yeah.
I know you are having lots of conversations
Yeah.
here at the conference. What are some of the top trends you're hearing about?
One of the big things that we're talking about is no surprise, it's AI. And I just actually completed a focus group, and our discussion really centered on AI to solve those existing real problems in the workflow. So, not fanciful, but really getting down in there and more quickly and better resolutions for problems that already exist. Things like medication reconciliation, just the basics, but better.
Oh, I love to hear that. Now, I'm hearing a lot about women's health in the industry, from care to research and even more. How is that conversation impacting you in the work that you're doing at FDB?
Well, first, I have to say that I'm just excited that it is an issue on the forefront. I mean, just the fact that ViVE is having this big panel on women's health, that says it all. You're asking about it, so those are all really nice things to see. In our area, a lot of what we do is try and expand the medication guidance to be more patient specific, and so that naturally carries over to women and women's health, because women may have different symptoms, they may have different dosing. We have to be especially careful about medications in pregnancy, and these are all topics that we're grappling with, and we're actually getting access to more data and being able to um, push things further from a variety of directions.
Oh, I love to hear that. And how is that kind of impacting the way the information, the pharmacy information is being brought to women and that
Yeah,
side?
yeah. So one of the things that I think is really hopeful is the way that they're doing drug studies, and it's been decentralized, and there's far more data out there that people can access, and so there's more information specifically about women. And then I'll just say, in our area, something like dangerous side effect like QT prolongation in the heart, it's more likely to happen in a woman, and we need risk scores where we look at that information, and with opening up of systems, we're able to get more of that information and add it into the guidance.
So fascinating. Now, amazing leader like yourself, my listeners love to hear about leadership tips and tricks.
Yeah.
So, if you could tell your younger self a piece of advice, what would you tell her?
Yeah. So I think that I may not give the same advice to everybody as I would give to my younger self, but I think there are people out there this would apply to. So I had my nose to the grindstone so hard, and I was just working really to get everything done. And I think you really have to look up and concentrate on the relationships too, because that brings you so much further, rather than checking off every single thing on that punch list is maybe not as important as connecting and hearing from other people that are around you.
Oh, so inspiring. Thank you for joining me today. I love learning from you.
Thank you. I love talking to you, Grace.